Antibiotic Awareness Day. It was actually last Monday. We had to sort of move things around slightly just to suit in with our setup at the hospital. So we sort of looked at doing things over Tuesday, Wednesday, Thursday last week. So what we did in that time was to talk to patients. We gave them a sort of patient-friendly quiz just to raise some awareness about antibiotic use. And we had a little competition for the wards, of which wards 5 and 8 were the winners. So they got a little prize as well. So, and it was sort of just to engage staff as well. So we're trying to sort of cover things in different areas. And then today is just a little bit of information for prescribers, as well as a little quiz just to take away as well. So you've probably all seen the headlines. So these are things over the last sort of couple of months. So lots of big talk about antibiotics on there. The apocalypse, catastrophic, biggest risk is terrorism. So there's lots of different things out there. And on that, you know, that's the reason why we're trying to sort of raise awareness and do what we can to reduce the number of antibiotics that we're using. So the Department of Health sort of guidance is quite simple really. Misuse leads to antibiotic resistance. So as you guys as prescribers, you don't need me to tell you this, but don't start antibiotics unless you've got evidence of bacterial infection. But when you do start them, start smart. So we're looking at the most effective treatment for the life-threatening patients. So yeah, of course you need to start them in those. Collecting samples, getting micro-advice, that sort of thing. Asking a pharmacist where necessary. And then the important thing I think for this particular trust is to sort of add some clear documentation. So in the notes from the drug chart, it just saves another question being asked later on. So as a pharmacist, we're often faced with a drug that's normally micro-restricted, but we can't really find where it's written down to say what it has got approval or it's for this indication. That just sort of helps with the communication side of things. That top little picture is the number of antibiotics approved in the US from 1983 to 2011. So as you can see, that's approved for licensing. So those numbers are dropping. And the main sort of reason there, pharmaceutical industries are less likely to promote and try and invest in new antibiotics because the sort of benefits in terms of finance just aren't there. If you take a patient that's on cardiovascular medication, they may take it daily for the rest of their lives. Antibiotics, generally short courses, the sort of money to be made isn't really there. So there's less of a drive to kind of push that. Although the government's having a bit of influence there, it's not really happening at the moment. So after 48 hours, review your patient and then go on to make a clinical decision. So in some circumstances you may be able to stop it altogether. Obviously there's a lot of risk associated with IVs, so where possible switch to oral therapy. Change of antibiotics maybe. And something that we don't really use here because of the nature of our hospital. So OPAT, the outpatient parenteral antibiotic therapy, we don't really use it here, but it's just something to be aware of. You've probably already seen these, but we have got a set of guidelines with each of the directorates. The dates on there have changed, so they have been reviewed in the last couple of months. And you can quite easily access them from the intranet. And the last message is it's not chicken feed. So antibiotic resistance adds billions to healthcare costs. Thank you very much for just a brief presentation on that. We are looking at a number of audits as part of our sequence for the hospital. So if anybody is interested, then either try and sort of grab me on the ward or drop me an email and we can look at what needs doing there. The main one that we need to look at for the next sort of quarter is to do with patient awareness. So whether the patient actually knows why they're on antibiotics, what those antibiotics will cover, and side effects and that sort of thing. So if anybody is interested, then feel free to let me know. Thank you very much.
Anish, are you typically based in the pharmacy?
No, so with this new arrangement that we've got, I'm not sure how many you were aware, but it was as a service level agreement from over the road from UHB. That's now stopped.
Yeah.
So we've got Boots as the operational supply side of things, but for the clinical ward-based stuff, we've got an NHS team, as you would do in any other hospital. So there's a handful of us that are sort of growing that team and developing it. And this is one of the areas that we're kind of concentrating on. Is that okay?
Yeah, that's great. Thank you.